Hello and welcome to another edition of Wellbeing in Spectrum Television. Wellbeing is an interactive program designed to encourage a healthy living. I am Mary Joseph. Please do well to follow us on all our social media platforms at Spectrum TV, or you can visit our website at spectrumtv.ng. It's barely 2 months into the year 2023 and Nigeria is still confronted with different health challenges and outbreaks, even while the country is still recovering from the effects of the COVID-19 pandemic. Lassa fever first discovered in Nigeria since 1969. That's over 54 years, but this is still seen as a public health threat. According to the Nigerian Center for Disease Control and Prevention, it reported that the Lassa fever outbreak in Nigeria in 2023 alone stood at 1,378 suspected cases and about 361 confirmed Lassa fever cases in 18 states throughout January. For the confirmed cases, this is about 71% increase compared to the same period in 2022. According to the same agency, 53 deaths among the confirmed cases were also reported in January, with a nearly 15% case fatality rate. Well, looking at the statistics, you will see that Lassa fever is taking its toll on Nigerians in the same way it has annually done around the season of the year. And that is why we need to talk about it, especially when Nigeria is yet to produce a vaccine against this disease. So today on the show, we would be talking about Lassa fever to know what it is and what we can do to prevent its spread. Well, this and many more will be the crux of our discussion on today's episode of Wellbeing. But before then, let us quickly take this short break. We'll be right back.
Good health, they say, is something you can't buy. But the decision to live healthy is a choice that you'd have to make. Join health practitioners from diverse health fields as they provide you with vital information to help your day-to-day health decisions on Wellbeing, your wellness talk show. Wellbeing airs every Monday, 7 to 7:30 p.m. only on Spectrum TV.
You're welcome back to the show. It's still the program Wellbeing, your wellness talk show that is designed to keep you health conscious. Do remember to follow us on all our social media handles at Spectrum TV, or you can visit our website at spectrumtv.ng to be a part of the family. Today on Wellbeing, we will be talking about Lassa fever, a viral hemorrhagic fever caused by the Lassa virus that is transmitted to humans through contact with foods and household items contaminated by infected rodents. So my guest is a community physician and a public health consultant who is also the chairman of the Association of Public Health Physicians of Nigeria, Akwa Ibom State Branch, Dr. Emmanuel Edward. It's good to have you join me on the program.
Thank you for having me. Thank you.
All right, so let's talk about Lassa fever. Can you give us an overview of what exactly is Lassa fever and why is this pathogen still here with us?
Okay. Thank you very much, Mary, for having me again. Lassa fever has been with us for a while now. It's a viral disease. It's an acute viral hemorrhagic disease that's caused by Lassa virus. It was, first of all, it's been there for a while, like I said. In Nigeria, it was found in a town in Borno State called Lassa Town. It's said to be zoonotic disease, zoonotic being that it can be naturally transmitted from a vertebrate animal, the animal here being a rodent, known as Nematomasis nasliensis. It's a multi-mammalate rat that we find locally in our communities. So it's actually, the rat itself is actually the reservoir for the virus. But when it comes in contact with man through its bite, through its feces, urine, or when it eats things that man easily comes to eat later on, it transmits the virus, to man, and the virus tends to, it tends to spread. That's just one way in which the virus can spread. Other ways are usually via patients that caught the virus and then come to the hospital for treatment, and they become a high risk to healthcare workers that try to take care of them. All right.
Okay.
So, like I said, the virus has been there here with us, and in 2022, we had over 211 confirmed cases of Lassa fever virus disease. And interestingly, this year we are actually having, and it's the early part of the year, we're actually having over 361 cases already with 53 deaths, all right, in the first month of the year. So it tells you that the disease is out there affecting close to 20 states, but about 20 states here. Like I said, it's been there. I don't know if I'm actually giving so much, let me just give you time to ask your question.
No, we actually need to know about this, especially when we, Akwa Ibom State, we are not yet ranked as one of the states that is being overburdened by this prevalence. So let's look at our society and talk about its prevalence. How is Lassa fever prevalent in our society coming down here to Akwa Ibom State?
Yeah, in Akwa Ibom, we have not recorded any case yet. Yes, to the best of my knowledge. And but that doesn't go to say that there may not be a case. This identifying a case is a function of surveillance. So it's with increased surveillance as it's happening in other climes.
Okay.
You know, we may actually discover that one or two people there may have this, but for now, it's not really. It has not really been recorded. It has not really been recorded in Akwa Ibom yet.
Okay.
However, we have cases, you know, in many south and south eastern states here.
Okay.
Okay, and like I said, in the first we have had over 361 cases in the first 1 month of this year, and that increased number is likely because you are having, you know, more people having an increased surveillance of the disease,
Okay.
and more reportage of the disease happening.
Okay.
Okay, so let me talk about this. The disease tends to be, it tends to be self-limiting in many cases. People contract the disease 80% of the time. They don't come down with symptoms. Okay,
Yeah.
but those that don't come down with symptoms tend to present with symptoms like fever, like body pains, okay, headache, and what have you. Okay, what we call the not definitive symptoms.
Yeah.
All right.
Yeah.
Then that period of time, the person comes down with this this sickness. The incubation period of disease, from the time the person gets exposed to the time the person starts having the symptoms, it takes like 6 to 21 days. All right.
Yeah.
So, at that period of time, the person starts having all the symptoms. That is the time the person is most infectious with the disease. All right. Now, some people, I told you that some people the disease gets resolved at that first time, but some move on to the next stage. They start having abdominal pains. They start having much more severe forms of the disease. Some can have you know, bleeding from the eyes and from other orifices of their body, and then in certain cases we have had some people come down with deafness as a result of the disease, even though the deafness is reversible.
Okay. So I would like to ask, what are some of the limiting factors that you would say is making us as Nigerians, as a country, to not really eliminate this from ever happening?
Okay. Well, we want to call it the burden of not eliminating the disease immediately. Well, Some of it is, I'll put some of the blame on the behaviors of people in our communities, our lifestyle to an extent. All right, so we are still struggling with certain kinds of practice, certain kinds of lifestyle that tends to encourage the spread of disease. Okay, what are these lifestyles? Number one, we are still battling with lifestyles such as consumption of rodents. This particular vector of the disease is delicacy in some localities. All right. So even if the literature has been like, okay, we cannot really, there could be some other vectors involved in the transmission of the disease, but we know from studies that this particular vector is, one of the main vectors in the transmission of the disease. And interestingly, it is a delicacy in a lot of places. Okay, so the fact that people tend to interact closely with this rat and end up eating the rat may just be one of the reasons why we still have a large transmission rate and burden of the disease. Another thing is that practices such as bush burning is still common in our communities, especially in the dry season. Lassa fever tends to be have a peak period from November to April where the dry season is prevalent. So within this period, there tends to be a lot of bush burning, and during the bush burning, there tends to be a displacement of the rats from their natural habitats into people's homes and environment, and can result in infecting people's food and all the rest, and that can lead to the disease as well. Apart from this, we are still having people practicing dumping of refuse, open dumping of refuse. Now, when people practice open dumping of refuse, you encourage these animals to come around your neighborhood and pick up food debris to survive, okay? So this practice encourages the spread of these rats in people's communities. Now, apart from this, we are still also battling with the issue of, healthcare workers receiving proper, because I told you that this disease is highly infectious, and when it comes into the risk is actually usually higher for people that come to, get treatment in the hospital facility. So, but we need to know that our facilities need to be much more equipped to handle the challenge of Lassa fever. We need more trained hands, more personal protective equipment to handle this disease in the health facility.
Okay, so can you just paint a picture for us? How contagious is this disease, so that someone who is out there would understand the dilemma that we are facing right now?
Well, what do you mean how contagious? We can't measure it. Lassa fever is contagious, but it's not as contagious as, let's say, disease like COVID or like influenza. What we call the, it's not as as if not. However, it is infectious, and you don't want to start measuring that. It's infectious there, so it's important people take care of themselves.
Okay.
When people identify, come down with fever may not be, like I said, fever may not be there.
Okay.
But when someone is already complaining of an ailment that is not responsive to natural treatment, normal treatment like anti-malarials, antibiotics, we begin to raise suspicion, and we usually require the person visit the healthcare facility for further assessment.
Okay, so prevention, they say, is key. What can individuals do to stem the tide for Lassa fever?
Okay, so like I said before, there are a lot of personal things that individuals can do. There are a lot of personal things or community-based things that people can do. So for like an individual, when I give these talks, I do say I don't like being in a position to say, okay, you don't eat your delicacy, or your meat. But what I would say is that when you want to, if you choose to eat any bush meat or all the rest, as much as possible, limit the extent the extent of contact with the animal, you know, as much as possible. So even bring the bushmeat to the house and they play with the bushmeat. They bring the bushmeat to the house and their children are found, you know, fondling with the animals, and this increases the risk of the disease. So if you have to eat the bushmeat, please, as much as possible, kill it properly, roast it properly, and, you know, make sure it's well cooked before consumption. Okay? That is if you have to eat the bushmeat. Now, apart from that, it's important that practicing some practices that we have been carrying out, like, you know, encroachment into the natural habitats of these animals, you know, a lot needs to limit that encroachment. All right? Yeah. So things like open burning will encourage, like I said, will encourage the animals to come into, to leave their natural habitats and come into the houses of people. So it's important for individuals also to take care of their environment, dispose their refuse properly. When you dispose your refuse in the wrong fashion with the food debris, you are attracting these animals to your house, you know, to come and breed, and then, you know, to put yourself at risk of getting the disease. Then, at community level, it's important that people are aware of this disease, people are sensitized, people, whenever they see an individual that presents with some of the symptoms I've mentioned, and it's not responsive to, like I said, the normal treatment with anti-malarials and antibiotics, it is ideal for you to seek health care from a healthcare provider. So that they can actually take much more pragmatic steps that will result in increased survival. Then the government needs to do a lot to provide and take care of healthcare providers, you know, because of course, you know, we're actually having shortage of hands in hospitals. So, but doctors, nurses, and all the rest need to be protected. Personal protective equipment, more hands are needed, you know, start to reduce the pressure of one person trying to see a lot of persons with disease and putting himself or herself at risk of a disease.
Okay, so would you say that education plays a very huge role in the campaign and also fight against Lassa fever here in the country? Because you mentioned something about that bush burning, eating rodents, and a whole lot of stuff like that. So do you think that education has a huge role in the fight against Lassa fever? Yes.
Well, education has a role. Education has a role. Sensitization, increasing the awareness of people about the disease has its own role. But people tend to have their own, you know, their myths and their, you know, suspicions. For many people that I've seen, they say, oh, this bushmeat was eaten by my father. Even enlightened people, even very, very enlightened people will say, we have been eating this bushmeat, you know, since the time of my forefathers, you know, and so you cannot just wake up in the morning and say we want to stop. So, you know, so that kind of thing. So it's important that we're educated properly, but at the same time, education needs to be followed up with practice. People need to really do much more to, you know, reduce the risk of them contracting the disease by their interaction with the rodents, you know, or keeping an environment that allows for that rodent to thrive.
Okay. So coming down here to Akwa Ibom State, what would you say is the level of sensitization towards Lassa fever so that people can be encouraged to know the do's and don'ts when it comes to Lassa fever?
Okay, so if you look at basically like that, sure, public health physicians, we are here, we have been sensitizing the people. I think the State Ministry of Health has also been doing a lot to sensitize people about this disease. And then, you know, with that, we need, even though that sensitization is ongoing, we still need to be very, very sensitive. We need to be very, very, carry out more surveillance in the face of people that have symptoms like that. They should report as much as possible to healthcare facilities. We need more facilities that can treat them without, being a risk to healthcare providers.
Can you hear me now?
What did you say?
Yes, let's come
Yes,
down to the treatment and also management of Lassa fever cases. What should be done?
The management of Lassa fever disease should be at the purview of trained healthcare professionals. All right, so you won't want to put the management of Lassa fever into the hands of over-the-counter drug administrators or the pharmacy. So I will say I've provided the preventive modalities for us, but in the event that you find a case of Lassa fever, please get to the healthcare provider, get to the hospital, and then you'll be given directions on what to do and how to prevent and how to handle the disease. It shouldn't be something that you try to treat at home by yourself, because in trying to treat by yourself, you're going to put every member of your family at risk.
Okay, so finally, because of time, let us talk about what some persons should do, especially those persons who are still in the wake of the myths and misconceptions of Lassa fever. What's your advice to those persons who are hesitant to take adequate care of themselves when we talk about Lassa fever?
Well, Lassa fever is, like I said, it's a disease. It's a very serious disease. And you probably need to see some of the cases of the disease. Maybe these days we have the internet. You need to see what's happening out there for you to really appreciate how bad it could get, and then for you to realize that this disease could have been caused by, just a rat in your neighborhood there. So it's important that you do the right things. You put your environment right, clear your bushes, dump your refuse properly, make sure there are some parts of the country where people spread their food items outside and they leave it overnight. They leave it, long periods of time. And then, all these animals come there and they could actually put their mouths into the food and, contaminate the meal as well. So they need to know that this disease is real. And they also need to know, that with better preventive steps taken, the risk of contracting the disease is going to be reduced. And you can actually live a better life for you and your family. Thank you.
But don't you think that there should be some policies that should be implemented to safeguard this from happening?
Yeah, there are environmental policies already. There are environmental policies that, try to encourage individuals to take care of their environment. Well, as you know.
Well, because of time, I will have to let him go because we're running out of time. So that was Dr. Emmanuel Edward, the chairman of the Association of Public Health Physicians of Nigeria, Akwa Ibom State Branch. And we were talking extensively about Lassa fever and what Nigerians need to know to reduce the spread of the disease. Well, from me to you, thank you so much for being a part of the show. Remember that you could also be a part of the family by following us on all our social media platforms at Spectrum TV, or you could visit our website at spectrumtv.ng to drop your comments and also your reactions to the topic that we just treated today. Join us next week for another edition of Wellbeing. My name is Mary Joseph. Do enjoy the rest of your day.